Hi everyone, I'm Dr. Pauline Stolzner, and this week we are going to be focusing on intersectionality in practice. Intersectionality is a framework to help us understand how multiple identities and oppressions overlap. Coined by Kimberly Crenshaw, it shows how people experience layered inequities, like racism and transphobia, or ableism and poverty. For nurses, it means seeing the full complexity of a patient's life, not just one label. Let's unpack what that really looks like in healthcare. A person isn't just their race, gender, or income. They're the sum of all of those experiences at once. Our healthcare system often sees people through just one lens, and that's where gaps emerge. Intersectionality helps us provide more accurate, personalized, and equitable care. Think about your patients. Do we tend to treat the condition or the person? What's the difference? A Black transgender woman might face racial bias, transphobia, sexism, and financial barriers, all at the same time. If we only address one piece, we miss the full picture. These overlapping forms of oppression are why intersectionality matters in clinical practice, not just theory. And those overlapping inequities often show up in outcomes and patient safety. Intersectional bias can lead to patients being misdiagnosed, ignored, or discharged early. They might avoid seeking care altogether due to past trauma. If we aren't looking at the systems patients navigate, we risk blaming them for outcomes caused by inequity. Have you ever cared for a patient who seemed non-compliant, but when you learned more, it actually made sense? Intersectionality isn't just about oppression. It's about privilege. We all carry privilege in certain areas, whether it's language, documentation status, or education. Recognizing that allows us to be more thoughtful and supportive when advocating for patients. So how do we bring intersectionality into our actual nursing practice? Ask open-ended questions, listen without assumption, and validate what you hear. Use inclusive forms, documentation, and language. Be proactive in creating care plans that account for both clinical and social realities. What's one area of your current practice that could benefit from a more intersectional approach? Try mapping out a patient's social determinants of health using an intersectional lens. Include race, income, gender, disability status, immigration status, whatever's relevant. What overlaps? What gaps emerge in their care? Intersectionality also guides us when designing systems and policy, not just patient interactions. When we rely on one-size-fits-all policies, we often leave the most vulnerable behind. Equity requires designing systems that recognize complexity. That includes how we collect data, train staff, and measure outcomes. How does your facility or organization address or ignore intersectionality? How has your own identity shaped how you're treated in healthcare or society? Where have you witnessed intersectional harm or resilience in your work? How can intersectionality help us become not just better nurses, but better humans? Intersectionality is a lens, a language, and a responsibility. Use it to honor your fullness of your patients and yourself.